Ready to go? Great. Hi, everybody. Thank you so much for being patient. So we are ready to get an update from Dr. Willis. This is the second opportunity we've provided for our leaders from our, whether teachers or classified staff. So we're just trying to make sure that people are aware of sort of where we're headed as we open school. As many of you know, some of our larger districts, or even Novato, is opening tomorrow for its first day. This is being recorded, as was the session on Friday, will be available along with this PowerPoint for you. Want you to know, though, that there's still some things that are in play, if you will, i.e. specifically the guidance around sports, right? We're still waiting for CDHP, and so Lisa will address that. Okay, but let's go ahead and get started. Thank you, Dr. Santora.
All right, I can't start speaking until I see a PowerPoint. But I just want to thank all of you for being on the call today. I know it's a busy time as school restarts, and I'm just our deepest gratitude for all of your support. Last year, we did lead the state in reopening, and it was because of your commitment to education and creating the safest possible environment that allowed us really to thrive last year. We're working in a different context, both that brings opportunities and challenges. The opportunities is we're a highly vaccinated community. Most of school staff are vaccinated, and most of the kids who are eligible, honestly, and they don't like kids, students, most of the students who are eligible are vaccinated as well. That's the positive side, but we're also navigating a new variant, the Delta variant, that we're seeing promising data from our local positive percent positivity that is declining, but it's a little contagious beast. So we will be following. I'll give you more information around COVID activity in our community at the end of the presentation. So we can jump ahead. We can do this. So I'm hearing a lot of. You can jump ahead. It's fine. We hear concerns from both sides. We are hearing concerns from staff and families who are scared to return to school with the Delta variant. And then we're hearing concerns from people saying we're being too restrictive with the return to school. And we strive to be research-based and evidence-based and guided by our local data. And as you've seen, always ready to course correct. But what we showed last year is that Marin County can safely reopen schools, and schools have actually reduced community transmission, because when schools reopen, people stop traveling, stop having as many parties, and our community stabilizes. So schools themselves are a protective factor. Until we know that probably it was in March when the Delta variant entered in our community. We started seeing significant increases in Delta activity in April. We were one of the few counties that were doing sequencing on as many cases of new cases as possible, so we could understand the behaviors of emerging variants in our community. And then in June, we saw our first larger school outbreak because of the Delta variant that was driven by unvaccinated staff and inconsistent mask wearing practices. And so we have done this. We continued to manage the Delta variant over the summer. We only had one additional larger preschool outbreak this summer, even while childcare and other indoor activities were in play. We only had those two significant outbreaks. And we learned a lot from last year. That being said, we did see a jump in our suspected in-school transmission when we were in yellow and had lower case rates, and now we have higher case rates. So we're prepared, and that's why, again, we're striving to make sure we have a layered mitigation strategies to ensure the safest possible school environment for school staff, students, and families in the larger community. You can jump ahead. And just to close that out by saying we will be continuing. Our epidemiology team today is working on making sure the dashboard is ready to go live for this next school year. So we'll be restarting that so we can again show all of our data in a transparent way to see, so the community can see how the data is informing in some of our policy decision making. And again, this slide just points out that we are always ready to change. We were ready to open schools because we studied what COVID-19 looked at other practices from around the world as schools reopened around the world. We knew this would be evolving. That's literally the nature of viruses, is to mutate and to survive and thrive. And so we knew we'd be evolving. To that end, we always were ready to course correct and adapt our guidelines to make sure we, again, created the safest possible environment that we can. And now we're on to the 4th version of our guidance document. Jump ahead. So it's going to keep changing. Delta, though, was a game changer. It had the most appropriate name. Delta does mean change. So it was aptly named. What we did, we were originally thinking we'd move forward with just like before Delta hit, that we'd have like a 10-point guidance document that really simplified reentry, because we saw low levels of transmission, high levels of vaccination in our community. But this time we've opted, and I think it's an elegant solution, to have a framework for mitigation strategies of different levels that you're going to see, and then identify which of the 32 guidelines are going to be applicable based on the current activity and what we learn about Delta's behavior when school reopens. And this is just to confirm that we are recommending both masking indoors and outdoors. You'll see that in the document. That places at mitigation level C in our strategy. Our goal is to get an A, but now we're living in the C land. And we also will be looking forward when, and that's part of the vaccine verification process, is being informed by the vaccination rates in different schools that there might be the ability to further relax some of our guidelines because there's high vaccination rates. I love Ken's background. That looks so peaceful. So our goal is get vaccinated, get vaccinated, get vaccinated. We are seeing an uptick in vaccinations. I think people who are on the fence around vaccination have seen how Delta is behaving. We see a significant difference between the case rates among unvaccinated and those who are vaccinated. Our case rate hit a peak of almost 44 per 100,000 for our unvaccinated residents. And at the same time, it was around 11 per 100,000 in our vaccinated residents. We are seeing increased proportions of breakthrough cases, which is concerning. But again, the most important thing for us is that nearly 90% of our hospitalizations since May have been in unvaccinated persons. So while we are seeing some breakthrough cases, those who are vaccinated are not experiencing severe illness. Those breakthrough cases experience much more mild symptoms, but we are still seeing the protective effect of the vaccine in the population on a whole, even though there are some more breakthroughs than we had hoped to see. So plenty of opportunities to get vaccinated. So we led the state again. When we drafted the guidance document, there was no state public health order around vaccine verification and testing for school staff. And that changed last week. So the state caught up to Marin County, and where we stand unique is that we are also requiring vaccine verification of students. So we are not recommending testing asymptomatic unvaccinated students. Students have a much lower, just because of their age, they have much lower viral loads. We also did not see student to adult transmission, and the cost of asymptomatic screening testing for students far outweighs the benefits at this time. If that changes and we see different data, we'll adjust that. But unvaccinated staff will be required to get tested on a weekly basis. And again, knowing the vaccination status will help us inform our mitigation strategies as we, again, both create more restrictive guidance and hopefully more relax our guidance based on knowing that vaccination status. And again, the primary reason, the hardest part of my day is getting the daily reports of seeing the individuals by name who are unvaccinated and getting hospitalized. This is a reality in our community. They're not just numbers. And the primary reason I want people vaccinated is there's so many, these are preventable hospitalizations. And as you may have seen, we had our first death in a vaccinated person, but that was driven by exposure to unvaccinated settings and higher risk activity and other chronic medical conditions. So there's such an opportunity to protect our community. So you can jump ahead. So get vaccinated if you're eligible. We're setting a goal for publishing the vaccination rates no later than October 1st. This is not going to be, we're not going to have the individual vaccine status of staff and students is not going to be shared publicly. So if parents and families will not know the vaccination status of their teacher. If there's there's always the ability to deduce vaccine status, but that's not anything we're going to publish or share. And the same thing with the students. We're not going to be sharing the vaccine status of the students, but if a student or a staff test positive, our first question is, what's the vaccine status? Because that informs our quarantine decision-making. Jump ahead. Testing. Where the school districts are going to be working to develop a testing plan for their staff who are required to get tested as part of this new health officer order. But there's plenty of testing opportunities that are free throughout the county. And so we'll be working with the superintendents and the private and public schools to just be assured that our schools in Marin have the ability to meet this new health officer order. And if unable, we'll identify additional supports to help ensure that teachers and school staff who are not vaccinated can get tested. Face coverings, that's probably the largest thing in my inbox, is people who are frustrated and upset that we're recommending both indoor and outdoor face coverings. As you're going to see in the next part of our presentation, we are relaxing many of the mitigation strategies with the goal of optimizing the learning environment. Masks are one of the most effective and simplest ways that we can prevent transmission, primarily through source control, where if you are personally infected with COVID-19 and you're wearing a mask, you reduce the risk of spreading it to another up to 70%, and also offers some personal protection. So if you're wearing a mask and someone is infected with COVID-19, you reduce your risk between 20 to 30% by getting infected with COVID-19. And so as you see relaxations in our mitigation strategies, we believe universal masking is a key strategy to start the school year. We just had a phone call with other Bay Area health officers. I've received many emails that why is Marin standing out when we're the most vaccinated? Again, it's because we're driven by science. We've been working throughout the summer managing the Delta variant in different youth settings, and we want to be able to support the return to school. Once we see lower transmission rates and we learn more about Delta behavior, our first goal is to move back from a level C to a level B and only require face mask indoors. We appreciate how challenging it is for kids to be wearing masks all day, and we're going to encourage mask breaks. But again, this will provide some stability for us as we re-enter the new school year. Jump up. Oof. So travel, this is another frequent question. There's people that have been traveling. We would everyone that has traveled should get tested 5 days after returning from travel. That's where we've identified cases throughout the summer. Is travel's been one of the largest not the travel itself per se, but the gatherings of other people in mixed households of vaccinated and unvaccinated. So really strongly recommending that anyone who traveled, vaccinated or not, should get tested 5 days after returning from travel. If unvaccinated students can return to school, we don't want anyone to be excluded from school unnecessarily. If they get tested 5 days afterwards, they wear their mask indoors and outdoors, they monitor for symptoms, and they can follow the modified quarantine guidance. That being said, they should not participate in other extracurricular activities until they complete their full 7 days of quarantine. I think we went through all of that. Jump ahead. So I keep mentioning our mitigation strategies continuum, that there's different levels, A through D. I'm going to pause and let Mary Jane, this is one of her concepts. I'll let her introduce it because I think it's beautiful.
Sure. So trying to outline for the community what the mitigation strategies are that we're looking at. And so the bottom line is the foundation: get vaccinated, stay home when you're sick, good hand hygiene. So we know how important that is, particularly the stay home when you're sick. Lisa didn't mention this, but the one outbreak in June did involve an unvaccinated staff member not wearing a mask and wasn't feeling well. So all of those things, I think, are part of what we have to be looking for. And, you know, as we've been talking to, to our partners, one of the conversations is that very often educators are, we got this, we're not going to miss school because, the students need us, et cetera. But this is not the structure that we want people to be working from. If you're sick, you're going to stay home. And obviously we continue to work very, very hard on those that are not yet vaccinated but are continuing to, consider it. So those conversations continue. Our hope is that we'll be able to move from about 95% where we are now to 100% to assure you all, anyone who's coming onto school campuses and forward facing with students, whether it's a substitute, a contract agency, that the schools are being sure that they are fully vaccinated. Lisa, would you mind just telling all of us here, when do you think that the vaccine will no longer be considered emergency use?
We are optimistic that within the next month to 2 months that all of the vaccines Pfizer, Moderna will receive the regular FDA approval that we hope will increase the confidence of groups that were frightened by only an emergency use authorization. We have now vaccinated millions and millions of individuals in our country. So we have ongoing data now since December of 2020. So we're going into 8 months of data of vaccination. So we're hopeful that within the next month or so, and in that same timeframe, we're hopeful that Pfizer will be requesting EUA approval for the under 12 population. So we think in the same timeframe for both the pediatric EUA and then for regular approval for. It'll be interesting to see if they provide regular approval for 12 and above. Again, we have millions of students 12 to 15 have been vaccinated as well. So ideally, the FDA provides regular approval for 12 and above, and then EUA approval for either 2 to 11 or 5 to 11. It depends on the outcomes of the case control studies that are currently ongoing at Pfizer right now.
Okay, so you can see A, B, C, D, that, A would be no mitigation strategies, which we well know that is not where we are. And then universal masking, always symptomatic testing, whether we're in A, B, or C. Universal masking indoors, outdoors, as Lisa indicated, we're at C. And then we would see the introduction of additional mitigations depending on where we go. So Lisa, would you answer this question? How do you decide where we are on this continuum?
There's going to be 2 primary data points we look at. One is just the overall levels of community transmission. So right now, Marin County has high levels of community transmission of COVID-19. So really looking for that wave, the crest of that wave, and to start seeing declining trends in the percent positivity and the number of new cases. And then honestly, this is where there's an art to science, is looking at the behavior that we're seeing of Delta in the school setting, looking at our dashboard, looking at potential school-based transmissions. And I think that's really what's going to inform us. If there's significant levels of, let's say we're still seeing declining rates, but we are seeing school-based transmissions, then it's going to delay our return to a B level. And with that being said, we're also, as community transmission goes down, that's when we'll also look at, can there be differences between schools that have higher vaccination rates? So we know that like some schools may have 100% vaccination rates in our county, which would be awesome. And so can we, again, allow some relaxations in schools that have higher vaccination rates and therefore a lower risk of COVID-19 transmission on the school campus?
Lisa, Morgan Agnew has a question.
All right.
About this slide. Morgan, why don't you go ahead?
Hello.
Are you there?
All right. We can let him interrupt us.
Okay. All right. That sounds fine.
Maybe we can put in the chat when he comes back that interrupt us.
Can you hear me now? Can people hear me now?
Hi.
Yes, gotcha.
Sorry, after Zooming all last year, I was on the wrong microphone. So,
exactly.
yeah, you'd think I had to figure that out by now. So I was just saying, first of all, thank you for holding this in this format where we can all see each other and have a real exchange. I really appreciate that. Much better than the webinar format, so thank you. My question is about D. In the elementary, that makes a lot of sense to me. Stable groupings. They're in one class, How does that work in the high school? How do we actually enforce D in the high school?
I think that's always been the challenge in the high school and the middle school settings. I think what in the high school, we would probably go back to some of more controlled movements in the hallways, in the classrooms. Again, that's not, we want to optimize that learning environment. So we know it's I would say it's near impossible in most high schools and secondary schools to avoid mixing of students. And again, I think that's just going to be what we evaluate. Our goal is not to have to return to hybrid or remote learning. And again, that's where we're going to be informed by the data. There is I think that's why one of our goals, honestly, is ensuring the highest rate possible of vaccination in our secondary schools. And really almost incentivizing participation in extracurricular activities to that vaccination, because some of our extracurricular activities like sports have higher risk of transmission. And so that's what we'll be focusing on, is really trying to increase that vaccination rate, that even though you hear in the news, and this is not to discount it, there are breakthrough cases, vaccinations still are very effective at reducing COVID-19 transmission, almost fourfold. So at our highest, we had a case rate of, I might have already mentioned it, a case rate of over 40 per 100,000 in unvaccinated. And at the same time, it was around 10 per 100,000 in an unvaccinated. So I think will be, again, one of those critical mitigation strategies in that secondary school population.
Thank you. So I'm hearing in the high school, we're not going to put them into separate classes, but we'll reintroduce the lines in the hallway that dictate where they walk. We'll look at sports. We'll look at extracurriculars, those sorts of things to try to give some more, to limit mixing as much as possible.
Right, to create more supervision and less structure. And then, as you know, and I got lots of emails, I'm sure you saw it, is once they leave the campus, as much supervision and structure that you provide and as strongly committed as the school is creating that, they walk out of Santa Fe High and then walk all together into a crowded setting in a taco shop. And I think that's our challenge. I know we're, unlike last year, we're also reopening schools with our community wide open, right? There's no restrictions on eating out, on a lot of indoor activities, which is, again, one of the primary reasons, if not the primary reasons, why Marin County and other Bay Area counties issued the mandate around indoor masking in public spaces, was to support the reopening of schools. We wanted to use every layer possible in preventing community transmission, so we can support a safer reopening of schools. And honestly, to keep businesses open, to avoid any required curtailments in business activity. Masks are very protective. So
if I could just jump in one more thing on this slide, and again, really appreciate it. The stay home when sick, this isn't a question so much as just a concern I wanted to pass on. As you said, teachers are really used to coming in when we have, the sniffles or allergies are acting up or whatever. And we have a limited amount of sick leave. It's generous by the standards of any profession, but it's also not unlimited. And a 10-day quarantine, if I have to stay home with my daughter because she's quarantined to preschool, which already happened this summer, that'll burn through my whole year's worth of sick leave right quick. So I just wanted to flag to you that it's definitely a concern, and we may have a lot of teachers who exhaust their sick leave and are not willing to take an unpaid day in order to stay home with what the Binax Now test they took at home tells them is not COVID. So I see that as being a real issue, and one that could be addressed if we had more sick leave availability.
Mm-hmm. No, and we appreciate that. And I could and I think that's part of our education, is when we saw, I can almost say the majority of cases that I heard from our schools team starts with someone having a sore throat, having a headache, and then saying it was allergies. If anyone feels like they have allergies and it's a new onset of allergies for the season, it's always best to get tested. And we're going to be working to make sure that we have as much Binax kits distributed to both staff and students and families, so people can test at home to support that. But I hear what you're saying. I think that's one of the challenges, and hope that people offer flexibility so people feel that they can stay at home and don't feel forced to work because of that. So should this really be stay home at sick unless you have a negative test? I mean, if I've got a negative Binax Now test, is that good enough, or are those? No, I would still stay home when sick. Period. We're also, because of community reopen, and this is going to be another telling year. We've learned that flu is less contagious. So by having our indoor mask wearing in place, hopefully, again, we'll see less flu. But it was not uncommon for people after traveling and engaging in higher risk activity to have the regular old colds and other symptoms. So again, definitely test. We want people to stay at home and at least be fever-free. If you're COVID negative, symptoms should be improving and be fever-free. And then just again, hand hygiene, mask wearing, really trying to reduce the risk of the spread of contagious diseases. All right, jump ahead. So we're going to run through this kind of like in sections of 5, and then we'll pause after each 5 so people can ask any questions related to the 5. The first 5 are really easy. We're going to be adapting just like usual. We expect all the basic health and safety practices to be in place. We have new staff, new students, new families. So really are strongly encouraging all school districts and schools to provide enough training for staff, students, families, so they can follow the guidance in their COVID-19 safety plan. A key for us, and I think a model for the state and the nation, has been our public health liaisons. So we've been having summer school. We didn't stop training our public health liaisons. They're really our super group, and they went to summer school all year and really are up to date with our practices. And they'll be key for us as we move forward. We absolutely are anticipating positive cases when school starts, because people are going to be coming off of travel and off of other gatherings, that even if it's out of state, so they're not getting tested because it's not required to get tested, but they went to Tahoe and hung out with 3 different families. We are expecting more case identification at the school level, and it's not going to be school-based transmission. It's going to be community transmission that enters into the school community. So these public health liaisons, thank them now. We know they're going to be busier than ever, but we've increased staffing on our side. We have a new school nurse. We have another volunteer school nurse that's joining us. We'll be looking internally to train more public health staff so we can provide the support schools need. And then lastly, we still want people cleaning. It's not the same high levels of disinfection, but every day after the school day, things should be wiped down, desks should be wiped down, and engage students in that practice and that behaviors. Foam mites are not the way that we transmit this disease, but we still want good hygiene practices in place. So I doubt there's any questions here, but happy to field any. So 6 through 9 is where we keep emphasizing over and over again to stay home when sick. It's expected that parents, caregivers, and guardians should be monitoring for symptoms, and any students should not be reporting to school. Again, we'll be working on implementing a home-based testing pilot. And our vision is by October, every family in Marin County has a Binax kit at home. So if their family members develop COVID-19 symptoms, they can get tested and they don't delay testing or go to school when sick. Everyone's expected to stay home when they're sick. If they develop symptoms at school, they're not going to stay at school. They're going to be going to the nurse's office in an isolation room and getting their parent or guardian is going to be called. There's going to be a lot of evolution around testing strategies. So we're expecting the schools to work with us on those testing strategies. One of the questions that keeps coming up is, why are we not recommending screening of asymptomatic unvaccinated students? And the reason is because students under the age of 18 often, one, have not been shown to be a driver of student to adult transmission, as you've seen in our data. 2, they have significantly lower viral loads than adults. 3, we've done over a year, looked at practices within our county around screening asymptomatic students, and also looked at other parts of the state where they were low yield in identifying new cases. The best method for identifying cases in students is symptomatic screening. That being said, if we do see behaviors that are concerning and determine that there would be a potential benefit of screening asymptomatic students, we would revisit that. But at this point, the evidence doesn't support screening asymptomatic students. So just to be clear about that. We do, though, for the unvaccinated staff, they will have to participate in weekly asymptomatic screening. All right, jump ahead. So we're updating our health protocols and communication templates. There's new scenarios. The state's offering a modified quarantine. So if everyone's wearing a mask and there's a positive case in a classroom, then students are allowed, in the past, if they were a close contact, they would have to stay at home and quarantine. If everyone was wearing a mask, the case and all the contacts, then students can participate in a modified quarantine, which would allow them to attend school, only school. They can't participate in any extracurricular activities or childcare, attend only school while they have to be asymptomatic. They have to be tested on day 5 to ensure that they are not positive. And then they can, if they are negative on day 5 and they remain asymptomatic, then they can end their quarantine after 7 days. So they can return to school on day 8. But in this situation, they'd still be wearing a mask indoors and outdoors. So those are the new protocols that we have to update our our communication templates to include that. And the intention around this, again, we did not, this will be a place that we evaluate. We had our one large outbreak that many of you saw in the end of the school year. We are going to be publishing information around that outbreak in the CDC MMWR, and so sharing local data. We did see higher levels of what we call it an attack rate of school-based transmission with the Delta variant. And so we are entering the school year recommending modified quarantine. But if we see Delta behavior that's concerning, we would revisit that. But at this point, as of today, August 16th, we're recommending modified quarantine. And any questions before we jump to the next bunch? Looks like, yeah. All right. So this is our first run of not applicable. So there's concern in the world on both sides. There's concern that we're being too restrictive, and then there's concern that we're not being restrictive enough. So this is based on evidence. This is not a winging it approach. Again, we've been managing the Delta variant in the youth setting all summer long. We believe that students need to return to optimized learning environments. And so we are, the requirements that are not applicable right now is physical distancing. So there's no minimum requirements for physical distancing. We do recommend that people maximize distancing when possible, but there's no minimum requirements. We're not requiring those stable classrooms where the one first grade classroom has to stay with itself. We're allowing mixing. The same things in the high school students. We're not requiring stable classrooms. We're not requiring that desks be not facing forward. And then staff can, this is I think the one that we have to fix, staff are allowed to visit multiple classrooms. And the key for us is really just to have attendance records. That's, besides knowing someone's vaccination status, when there's a case on the school campus, the second most important thing is for us to have an understanding of how the case moved through the school campus. And then, and that's enabled by having good attendance records at the classroom level. And then, any questions here?
Well, I have a question that I put in the chat. I want to talk about ventilation. I'm not sure if this is the time or if you want to wait.
Oh, we'll wait, and then we'll do the ventilation one because that's in the next section.
Okay.
So, and again, schools can be more strict than our recommendation. So schools can't be less restrictive, but schools can be more restrictive. Some schools found better practices with kids moving on and off campuses, but what we saw sometimes is that when there's strict routes of entry, there was huddling. It's because people weren't able to move. So there's actually more people spending time in close proximity. So we're no longer recommending defined routes or schedules for arrival and departure. Congregate movement is allowed. We are allowing school assemblies at this time. And so that would be something, for example, if we move to D, those would be things that we might consider pulling back on if we move to mitigation level D, if we see significant school-based transmission in our classrooms when school reopens. And then 19 is the one we do believe if we can, we want to ensure that schools do have good air quality. We know a lot of schools made significant investments in ventilation. And so that remains applicable to the schools, is really ensuring the higher quality and airflow. So optimizing the HVAC systems, using portable air cleaners, keeping windows open. COVID still doesn't like the outdoors, even though there's evidence, especially like in wedding-like settings and parties outdoors where people really are socializing closely together. There's evidence that Delta is more contagious in that. But again, we still see that outdoors as protective against even the Delta variant. So this is probably a good time for the ventilation question.
Okay, so at our school sites, we in the past year we shut down our return air. So in other words, the air from the classroom was being pushed out the windows as opposed to being recirculated, which a typical HVAC system would do. It's come to my attention just today that they're talking about opening the return air. And if that's the case, then we aren't going to have positive pressure in the classroom. And I'm just kind of curious, do we think that the general HVAC systems are enough to keep air circulation? Is air circulation enough, or does it have to be fresh air circulation? Because
I think air, so just like you see on the airplanes, probably depends on the system. So I am not an HVAC expert in any way. If there can be fresh air circulating, like in your car, when you want to stay warm, you circulate what's in the car. that system will circulate more droplets that could potentially contain infectious materials. So that's why you open outwards to pull in external air for circulation and try to exhale the air that has been building up. I'm not an expert, but that's where I would follow up with your school facilities folks, because now would be the time to make sure we have the same optimization that we had in place last year going into this school year. I would not see this would not be the place I would see we should be relaxing on ensuring good air circulation of fresh outdoor air into our spaces, unless this some super airplane level HVAC system that I don't think, maybe some of our schools have, but I think most don't.
Thank you.
So then a bunch of, we used to think that when we first drafted these, we really didn't know about the behavior of COVID. So a lot of the guidance was based on potential fomite transmission. That's when there could be a COVID droplet, a COVID infected droplet lands on a toy, and then the kid touches it, and then another kid touches it, and then they get infected. That is not a primary driver of infection or transmission. So now kids can play together on the shared equipment. Kids can be outside together. Number 21 is we were envisioning when we started school last year that we wanted 6 feet distancing. And so we were trying to help schools see their school campus more widely. We now want to focus on having optimized learning environments, which really most of you are teach best in your classroom. So want to make sure that we expect people to be teaching in their classroom, and so you don't need to seek outside space. We do want kids to eat outside as much as possible. When you talk and you eat in your talk at the same time, if you're infected with COVID, the likelihood of droplets coming out is higher. So eating outside is still safer. It's not required though. So especially if we have smoky days or rainy days, which will be ahead of us, it's okay to eat indoors. We'd again just recommend maximizing distancing, and then eating for shorter periods of time, with most kids can do anyway, because they want to get outside and play. And then just thinking of the cafeteria and the furniture that might be in place. I know especially the elementary school kids will huddle. We would recommend that the tables seat the number of children or students that the tables were designed to seat, rather than having 20 kids on a table designed for 10 because they're small, having them bunched together. So we would recommend that.
Lisa, there's a question here. Can students sing indoors or play wind instruments indoors?
Right now, we would recommend that, and this is besides sports, band, and music is our second most frequent question. We still haven't received guidance. I would strongly recommend that all band practice, woodwinds, choir be outside at this point. This is where I think it's going to be really important to know the vaccination status. You know, if you have eventually, as we get the vaccination verification process and we know that the band is fully vaccinated, it's raining outside, we're going to be less concerned, and COVID levels come down, we're going to be less concerned about them being indoors. But right now, as the weather holds, we would recommend, especially the woodwinds and the singing, to be outside. If it has to be inside, we would recommend the singers wear a mask while they're singing, unless they're performing. Even if they're performing on stage, we would still recommend considering the potential risk, or making sure they're separated by more space. Even with tuberculosis, you've probably heard me talk a zillion times, but when we had our large tuberculosis outbreak, it was driven by bands and music. That was when I think I first started in 2014. We had over 50 cases of tuberculosis, which is a lot for Marin County, and it was all driven by woodwinds, brass, and singing in an indoor setting. So that's why we really would recommend everyone being outdoors. And then the last one with 23 is that we want to be really strict about hand hygiene. So we're basically recommending schools interrupt their regular scheduled programming to make sure there is hand washing breaks. We're not recommending that now, just to make sure that the classrooms are stocked with sufficient hand sanitizers, that your bathrooms are always stocked with soap, and the water is working. So just as students would normally request permission to leave and go to the bathroom, that they have the hand washing capabilities. And so 24 is the big one, the one I know that's causing a lot of frustration in our community. We really believe with the Delta variant that we need to be conservative with masking. You'll be seeing other counties in the Bay Area shift towards recommending indoors and outdoor masking. It is because it is very effective at reducing potential COVID-19 transmission. So ideally, we shift from B to C as soon as possible. Again, not seeing significant levels of school-based transmission, seeing consistent reductions in daily cases and the percent positivity, those will be the indicators that will allow us to shift to making outdoor masks an optional decision. And so that's where we are now. Again, training around face coverings. I think this is the other place that I get a lot of concern from parents around the other side of parent and guardian feelings is fear about returning to school because they see students and teachers and staff aren't good at face covering. So really reviewing face coverings, make sure you adjust your face up ears. You're not playing around with your face and then touching your face and then touching other things. So making sure people know how to use and that they're properly fitted face coverings. The next one again is around the fomites. So we don't need, students can share equipments and books. We don't have to, there's a time we were quarantining books for 72 hours. So those days are over. Those are not drivers of COVID transmission. It really is droplet transmission. People coughing, spitting droplets, sneezing droplets into a more crowded indoor space with poor circulation. So households remain the primary driver of transmission in our community. At least 60% of our cases in our community are in private, are through household transmissions. And then physical barriers, they were never science-based. They certainly reassure people and they provide a barrier to a droplet, but they were never recommended by us. We said they could be considered, but it's not applicable. So we're still recommending, especially with the Delta variant, that you do limit the visitors and that any of our, this is not related, so staff are required to verify their vaccine and unvaccinated staff are to get regular testing. Anyone that is not a staff that's coming on campus to assist, they should be fully vaccinated. So we see these as non-essential visitors. We know that non-essential, many of your non-essential visitors are actually essential, but we would expect that a parent who volunteers should be vaccinated, and that would be our recommendation. There's one thing I was thinking, oh, it came up on back to school nights. We are not recommending that you check verify vaccine status for parents and guardians who are just coming on campus for a short-term interval for a back to school night. They should be wearing their face covering. They shouldn't be there if they're sick. We would recommend back to school nights be a great opportunity to promote vaccinations and the importance of vaccinations to keeping schools open and reducing the risk of COVID-19 transmission on the campus. But we don't want to exclude parents from these kind of one-off opportunities if they're unvaccinated. This is the next one, vaccinated. This is reemphasizes the earlier slide. And that we do see vaccine verification as critically important because it's going to help us inform relaxations of policies, especially again at that secondary and high school levels where our goal would be, there'd be some schools that have over 85% vaccination rate, then we could potentially relax indoor masking in those schools that have high vaccination rates.
Mm-hmm. So Lisa, right here, are we going to have vaccination data disaggregated by class? Would we know what % of the band is vaccinated or just the whole, or just the school as a whole?
Yeah, our vision is just the school as a whole. We would want the vaccination status can be used internally and in consultation with public health. I don't see a competition of the bands by vaccination status. That's not the intention of this. It's really just to help us see a bigger picture of protection in the community and again, opportunities for relaxation or identify where we can't relax areas because there's low vaccination rates. So the risk of COVID transmission in one particular school is higher because it has low vaccination rates among staff and or students. We have strong protections. So we have a policy where you can't, there might be some schools that can't report vaccine status because we have a policy to protect personally identifiable information. We have a small numbers policy that, for example, there has to be more than 10 vaccinated, more than 10 partially vaccinated, and more than 10 unvaccinated to even report publicly. So there may be some schools, let's say there's only 5 partially vaccinated and 7 unvaccinated staff, that those numbers couldn't be reported because people could deduce. So 10 is a standard threshold for making sure any reporting levels is at that level. So I think that would be the challenge with any classroom level reporting or any grade level reporting, would be trying to balance public knowledge around vaccine status in their school environment versus protecting personal identifiers. We have been waiting since May, and every week since May, they told us to be a couple of weeks for the CDPH to issue its updated guidance related to school activities, primarily sports and music. We have not received that guidance. We have a conflict in guidance where we have guidance around in-person instruction, where we're saying everyone on the school campus needs to be wearing masks indoors and outdoors. And then we know that school campuses are also used for non-instructional purposes. And so the only guidance that we have is the April guidance related to sports and youth activities that was issued before school ended. And we would refer at this time until additional guidance is offered. Schools that are trying to prepare for the school year, already in the school year, we would refer them back to that guidance, even though it might be different. I don't think it's going to be significantly different because of how much more, and I think this is why the state is struggling, because we don't have federal. If you go to the CDC and try and look for other guidance where it relates to sports and music, it's not fine. You can't find it. So I think that the lack of guidance from the federal government in this area is stymieing the state. Other states haven't commented on it. As you've seen, we work in, our states have different political landscapes that inform masking decisions and mitigation strategies. We're on the more restrictive side. So I think California is also political too. So I think they're navigating both politics and science as they prepare the guidance as it relates to youth activities and certainly sports, which we know are important in our communities, our school communities and community at large. So at this point, we would just refer people back to the April guidance, and that would probably be the best guidance to follow until we have an update from CDPH. And then, but because we haven't changed our 32-point guidance, we just have applicable and not applicable. Your COVID-19 plans probably just need to review, your schools will be reviewing them. Again, some schools may choose to be more restrictive because they found better practices on the ingress and egress of kids because they were creative and innovative and they found that's a better way to do it, and they might keep them in place. Or they may opt to return to regular operations because it's allowable under public health. We're going to be following this closely. We're going to be doing a check-in every day once the school starts, we know school starting this week, basically, and monitoring that activity, regionally and at the state level. And it's possible we have an update, as early as 2 weeks from now, or it's possible that we really just see strong commitments from families and staff in creating the safest possible environment. And with those layers of protection, really have a lower risk of COVID-19 entering the school community. We demonstrated it with, these are supportive supervised environments that have stabilized COVID transmission in the community. That's what we're anticipating now. But if the data suggests otherwise, we're ready again to course correct and recommend guidance that is more restrictive to, again, our goal is keeping school open, but ensuring it's as safe as possible for staff and students and families alike. Oh, all right. So this is a little outdated, but it's, I apologize for that, but we're doing really well. As hard as it is in Marin County, we're not experiencing hospital surges. We're not experiencing the same case rates that other counties across the nation and even across the state are experiencing because we have a high rate of vaccination. We're almost at 90% of our eligible population being vaccinated. For the 12 to 17 population, 78% have received, have completed their vaccine series, and 88% have received at least one dose. And the reason why there's a gap is because we've seen a surge as students are returning from their summer holidays. We've just seen a surge of our 12 to 16-year-olds getting vaccinated. So that's why there's a 10% gap between the fully vaccinated and unvaccinated. We're ready. We already have started planning in partnership with the Office of Education. So when pediatric vaccines are approved, if they're approved on Wednesday, our goal is be ready to offer a Super Saturday on the Saturday that week. So we also have been working with the pediatricians across the county, so they themselves can offer vaccination and have vaccine supply. We know with this younger age group, more parents will want to talk to their healthcare providers, so our pediatricians are ready to vaccinate the pediatric population as well. Jump ahead. So this is our daily case rate. This is the promising data. So we expected we expected to see a surge after 4th of July. That was just, it's a natural gathering. People are drinking. When people are drinking and socializing, even in the outdoor settings, we knew with the Delta variant being more contagious that there would be a 4th wave or a surge. We were expecting in Marin County, though, probably to be for that peak to hit around 30 cases a day and then to start going down a little bit more quickly. It looks right now from this, and this is a little bit older, but it looks like we're heading in the same way, that we may have hit that peak and we're starting to go down. And that's because we have a significantly vaccinated population. When the Delta variant runs into a vaccinated person, even though there's a possibility for a breakthrough case, it's more likely that the vaccinated person will not become infected with COVID-19. So this slide allows us to be cautiously optimistic that we're starting to hit that crest of that 4th wave. That being said, we've seen sometimes it pops up again, but again, we're hoping that school is a stabilizing space.
Lisa, will we have that chart updated for the community meeting?
Yeah, I'll make sure that, yeah,
On
I'll
the
make sure
17th.
if Ken can send the link, this link.
Yeah, absolutely.
So this is, I'm really proud of the county. When cases were low, we led the state and the nation in sequencing. So we made a goal. We didn't have a lot of cases and we knew variants were a concern, especially with what we saw happening in India. And we do look we're not just looking locally, we're looking internationally about how COVID is behaving. We made a goal to sequence 50% of all new cases as early as March. And so that allowed us to be in a county that identified the Delta variant as early as April. And what you now see as this has gone through week by week is how dominant how contagious and dominant the Delta variant is. That now 100% of all specimens that are sequenced in Marin County are the Delta variant. So it's taken over all of the other variants that used to be variants of concern. We jump ahead. What is reassuring to us, and this is again, we'll make sure this is updated for the community presentation tomorrow, but the data is not significantly different. In January, when we were in our 3rd wave, we did not have a fully vaccinated community. So we had, it was typical that 5% of active cases would be hospitalized. So in January, probably at this time, we had around 500 active cases. So we had nearly 30 people in the hospital. On August 11th, when we had more than 500 active cases, we had only 10 persons in the hospital. And again, unfortunately, the majority of those people were, 9 out of 10 were unvaccinated people. So this is these are preventable hospitalizations. So you can jump ahead. And this is what I was describing before, is when you look at the risk of it being affected by COVID-19, it is significantly greater. The orange is if you're unvaccinated and the blue is if you're vaccinated. And this is where we control for population. So we just look at the case rate. So it's the rate per 100,000, where we had that peak of, at that peak it was around 44 cases per 100,000 in the unvaccinated. And on that same day when we're at 44, it was around 10 cases per 100,000 among the vaccinated. So again, the vaccine is protective. It prevents hospitalization, but it also prevents and halts transmission, which is why we want to keep cocooning this, our last group of unvaccinated, which is that pediatric population. And the other question I get a lot too is just like, why vaccinate the pediatric population if they don't get so sick? They definitely play, especially in the adolescent population and increasingly so in the pediatric population, they play a role in transmission. And so we want to normalize and stabilize our community and prevent, slow the spread and prevent illness. And it is an informed decision. It's not compulsory for vaccinations, but we'll be strongly encouraging, as long as the science shows it's safe and effective, that our pediatric population gets vaccinated. So again, we can start returning to a more normalized living in the school setting and in the community setting at large. And then there was one other thing that's floating around is this is a lot of media coverage around increased pediatric hospitalizations. We are not seeing that in the region. If you compare the pediatric hospitalizations now between that 3rd wave in March, there's less hospitalizations right now than we saw in March. In southern states, they're both unvaccinated. There's also one of the 2 factors that increase the risk of hospitalization in the pediatric population is asthma and diabetes and obesity. And unfortunately, in the southern states, they're disproportionately experienced by the pediatric population in those states, especially communities of color in the southern states. There's tremendous health disparities and chronic conditions, even in that pediatric population. So that's why you're seeing that. We are not seeing that locally. Pediatric ICU capacity is always an issue for us, not in emergency times. We never would have sufficient pediatric ICU capacity. So it's an ongoing issue, but we're not experiencing a surge in pediatric cases. And we've not ever had a hospitalization of a person under the age of 18 related to COVID. We've had someone under the age of 18 who tested positive for COVID that was admitted to a hospital for another reason, not due to COVID. But we haven't seen in Marin County pediatric hospitalizations related to COVID-19. But I know that's very much what's in the news and driving some concern around parents. So we're seeing a resurgence. Our hospitalization is stable. Vaccinate, vaccinate, vaccinate. Face coverings are simple and effective, and it's a mitigation strategy we think that's going to support the safer reopening of schools. We are being cautious, more cautious than some want, and maybe less cautious than others want, but we're ready to course correct. And that we know the state vaccination policies, for example, now for school staff are being implemented to promote vaccination adoption in higher risk settings. And school is not high risk like a nursing home, but it is a socially dense community. And we want to make sure we create vaccination is a great tool to protect socially dense communities like the schools. Right. I think that's it. This is your slide, Mary Jane.
What's next? So tomorrow at 1 o'clock, there'll be another session. This one has gone out to all of our community members. So, we send it, to multiple agencies, parents, etc. So that's tomorrow at 1. All of these, just as a reminder, are essentially recorded and made available. Usually it's within about 10 hours, and we'll be posting those. That will continue with these public health updates each month. So you can see we have them pre-scheduled. So we're trying to plan ahead. Public health liaison, weekly meetings are set for every Thursday at 4 o'clock, which is essentially the schedule that we held before. As Lisa mentioned, people serving in these roles are providing great, very valuable information. So we have our meeting today. We'll be interested if you consider a meeting like this valuable to you all, and you would like us to have this kind of a meeting with labor leaders on a monthly basis. We're prepared to do so. So you could put a note in the chat if you would like to do that. We've had, I think, we offered 2. I think we had about a total of about 30 people. So we're okay. Thanks, Linda, for your message. So we can go ahead and set that up for you monthly, and then have a conversation that would be the meeting tomorrow is in a webinar format. And as you know, and this meeting is not, we are working with everybody to get the school site specific plans. There's a new template available, and then we have maintained the support at the county office. The Rethinking School team continues to meet 3 days a week at 7:30 in the morning. And then we also have this rapid response for anyone who has questions, and we try to get back to you as soon as possible. And as Lisa mentioned, they've also expanded the public health COVID schools team. So we will go ahead and make sure that all of these resources are available. Let me just see. That's what the teacher should. It's helpful to have these meetings during a time that's not right. So then RF101, which makes it impossible. Yeah, so the meeting, just for you to know, the meeting that's tomorrow is really more general and not as specific as this particular meeting. So we're trying to schedule meetings that work for a variety of people, but we'll go ahead and schedule additional monthly meetings with our labor leaders, and we'll make sure that these happen at, is the 3 o'clock time frame work? So today was 3, or would you prefer that it's later, like 4? So we're flexible if that would work. So,
and I just want to tell everyone, as you might be putting in the chat your preferred time, there's no surprises at tomorrow's community meeting. This is all the news that's fit to print today. Again, we just try to have different venues. Tomorrow will be more families that are participating, and there might just be Facebook chat of those who can't believe that we're
Right.
opening versus those who can't believe that we're wearing masks. So unique dialogue that might be in the social media space. But there's no new surprises. This is all the news that we have.
Great. Okay, so looks like we have sort of a mixture between, Morgan, when you say prefer 4 with 3:30 work, that's kind of in the middle of those two? Or are you still in class after 3:30?
Checking. Depends on the day. Mondays, Tuesdays, and Thursdays, our school goes to 3:45. Wednesdays and Fridays, we're done at 3.
Okay, all right, so this will totally be a working with Dr. Santora's schedule to try to put it in, but Lisa, it sounds like 4 would be good, because that will put it so that regardless of the time, and then we can figure out the day that would work. Okay, all right, anything else? All right, great, thanks everybody. We'll get a schedule out to you all and appreciate your good work. Happy back to school.
Thank you, everyone.
Cool.
Thanks for the meeting.
Bye, you're welcome, bye.